Hi, my name is Shelby,
Hi, my name is Lauren.
and we did our project on war.
So, the introduction of war is defined as a state of open and declared conflict states or nations. War has been part of history for many years. Outside factors can lead to the rise of war. However, many do face obstacles that individuals deal with, some social and ethical issues within the war. So some causes of war are veterinarians would want to be able to go out and fight for our country. Countries also want to be in control of another country's prosperity. Religion could be another cause, and territorial gains.
War can impact a person's health in many ways. For example, a conflict such as war impacts a person's overall health mentally, socially, and physically. And this is where soldiers often struggle to return back to their normal routine when coming back from war. So maybe they aren't as likely to just go back to their normal lifestyle with their same childhood friends and same experiences as they would. And it may take them more time than someone that has been just not affected by such a terrifying event. Also, many soldiers come back from war with depression, anxiety, and post traumatic stress disorder. Later in the presentation, I'll discuss more in depth about how common post-traumatic stress disorder is. And it is important to understand that the soldiers aren't the only ones affected by wars, and their health is also affected by their families and friends when they come back as well. Post-traumatic stress disorder. PTSD is a mental health disorder that is caused from a terrifying event such as war. PTSD is also one of the most common health consequences of war. Some common symptoms of PTSD include nightmares, flashbacks, anxiety, and depression. And the symptoms can vary depending on the person. So someone could have not a lot of symptoms, where someone can have a tremendous lot of symptoms. So it really depends on the person. And overall, it can impact a person's life at home and in the workplace. Please take a moment and watch this video, how a former soldier copes with post-traumatic stress disorder while balancing his life with reality. How was it when you came back from war?
So I returned from war kind of under unique circumstances, mainly because I was shot. I was wounded. So I was shot several times, one of which hit me in my left knee. And that, kind of ended my time in that deployment. So it was difficult when I came back for kind of several reasons. And the best way I can describe it was I didn't really have a place. I was like in limbo because, my friends were still deployed. So they were still over in Afghanistan. Because we were only about 3 or 4 months into our deployment, and they were there for 6 or so months. So we went through our full deployment. So I had friends still there, and then I came back home. So I came back to New Jersey. I grew up in Monmouth County, so it was weird because I had all my childhood friends and family, and they were super stoked that I was home, right? Because I wasn't deployed anymore. But for me, it was I was conflicted because, I was happy to be home and relatively safe, although, I had to have 7 surgeries on my leg, and it was, 2 years of physical therapy. So I wasn't happy about my injury, but I also felt like I was letting my buddies down because they were still over there doing the work and doing the job that, I wanted to be doing. So, and then being home, I was 21 at the time. So none of my childhood friends enlisted in the military, which is fine. I wanted to do that. It was what my kind of career path wanted to be. But it was, I had unique experiences from the time I was 18 until 21, where, during that time I was preparing to go to war. I was doing lots of demanding training, et cetera, et cetera. So my experience was different than my childhood friends who from 18 to 21 is, traditionally is a lot different. So coming home after being shot and coming home from war, to get to your question, was difficult because I didn't have the relationship with my teammates in the military because they were still deployed. I was home, which was nice to be home, but I couldn't necessarily fully relate to my peers and friends because over the last several years, I was doing things much differently compared to what they were doing. So there were challenges, but ultimately it was a good thing because it led me to pursue education and get a PhD and end up working at Monmouth. So at the end of the day, it all worked out. But it was very challenging, and it took several years to kind of find my place. And that was probably the other component, was having a purpose. I had a unique job. I was a medic in the military and worked with snipers. So these are two kind of unique roles that require a lot of training, so you kind of gain confidence and have a purpose, where when you're no longer doing that and you end up just being, kind of a normal person again, it's hard to find purpose. But I found that with education and teaching and the things that I do now. So it led into a new passion for me.
So that was going to be my next question. Did you go back to your normal routine when you came back?
Yes and no. It was difficult because I was, I just had knee surgery. So I was on crutches for 6 months. And then I had approximately 7 or so procedures over a 2-year period. So I was having surgery, physical therapy. So some of that I was familiar with because I trained. We did a lot of physical training in the military. I enjoy physical training and exercise. So my rehabilitation kind of became my focus. So that was normal to me. But it was definitely a lot different because, you're not surrounded. For a long time, I wasn't surrounded by the people that I was used to being surrounded by. I started to work. I was still in the military at the time, but I worked at because I was a medic, I worked at a clinic. So, I was used to being out in the field, carrying a gun, doing those types of activities versus taking someone's blood pressure and suturing them and doing more clinical type of work. So I was familiar with it, but it was definitely not what I wanted to do.
And what was your hardest challenge when you came back from war?
That's a real complicated question because I don't think there's a lot of components to it. And I think difficulties with experiencing war can change with time, meaning, right when I first came home, I didn't really think too much about what I did and what I experienced and the challenges that I had to deal with. But as I got older, I reflect back, this is 15 years ago that I was shot. So it's like now being older, more experience outside of the military, I look back and I'm like, man, that was really insane stuff I was doing. Like, extremely dangerous. There were mountaintops. Like I was up in the Korengal Valley in Afghanistan, which is some of the most dangerous and rugged terrain. And it's highly hostile, meaning the people don't like us being there. So there's lots of difficulties. So I guess to address specifically your question was what would be the difficulty is, I guess, moving on from that, meaning, hey, that was a great experience. I learned a tremendous amount from it. And how can I use that to integrate into my civilian life, right? Just because I went to war or I'm a veteran, etc., that doesn't mean I'm special, okay? It does mean I might have unique situations that I've been exposed to, but how can I use those experiences and the knowledge and the training that I received in the military, how can I apply that? And that was hard for me to figure out, what am I going to do? I went from, hey, I want to be in the military, that's my job, to essentially being like, hey, like, you can't do that anymore. So I had to, and I never wanted to go to college in the first place. It's completely crazy that I have a PhD, but that was the hard part. And when it clicked, it worked. So I guess the hardest part was, how do I leverage my prior experience and skills into what I'm trying to accomplish now? And once I figured that out, I was successful. It took mentoring and going to school and interacting with faculty and other peers and people that helped me along the way. But nonetheless, so finding that purpose again, I guess, would be the most difficult aspect.
Okay, great. And then last question, while you were in war, were there any ethical issues that you saw that took place? And if so, what were they? And were there any possible solutions to them?
So war inherently isn't very ethical in a sense, right? Like if you really boil it down, one of your main goals or objectives is to destroy your enemy. In that case, kill your enemy or make them incapacitated so they don't want to fight. Now, with that said, there are rules to war. So you have the Geneva Convention. So there are certain kind of guidelines in which I have to follow, even in a combat zone. So, you know, I had rules of engagement that were given to me by lawyers as far as, hey, if a person is a fighting age male and carrying a weapon, yeah, like I can shoot that individual because they're a danger, right? It gets more complicated, particularly when you're not fighting, you know, a uniformed enemy. These people run around in pajamas. They're not like, you know, they just like normal population. So with that said, I never witnessed any ethical type of violations, if you will. I mean, it occurs particularly from the enemy side as far as, you know, I'm sure everyone's seen on the media before of people speaking of beheadings and videotaping these things and putting them out for propaganda purposes. This is very real, you know. So there are ethical violations, but for the most part, particularly, you know, us, the coalition forces, we follow very strict guidelines and we're somewhat constrained about the use of force. And we want to consider how we apply force, right? If we're there to try to gain the trust and a relationship with the local population, right? We don't want to be causing indiscriminate killings or collateral damage or going into a place and destroying all their infrastructure. So, you know, these things tend to occur, but we do try our best to follow some sort of ethical guidelines, and that's set forth by the Geneva Convention.
Okay. And that's all I have for you today.
All right, cool, Shelby.
Some ethical issues are how to mandate psychological evaluations and treatments when soldiers return home from war. Lack of access to doctors, treatment facilities, and group therapies. Sexual assault and rape is another big ethical issue due to war. And discrimination in gender roles and how it affects veterinarians is another cause.
Solutions to war. So some important solutions of war that Lauren and I found that were very important was soldiers and loved ones to seek health professionals and attend group therapies. It is so important that these soldiers and loved ones find these resources so that way they can express how they feel, and any treatments needed, their health professionals can give them access to these resources. Also, it is very important that soldiers attend workshops and educate people for the better. As we know, when soldiers come back from war, maybe they're not, you know, very willing to want to get help, but definitely attending these workshops and educating them for the better will definitely improve their overall health. And implementing more treatment centers throughout the country. As we learned, you know, the lack of access of healthcare around the world is a very big ethical issue, but implementing more treatment centers so that way soldiers can access them can definitely benefit the soldiers as well. Psychological evaluations when returning back from war, and to discuss problems when civilians regarding discrimination and how it can impact a person's overall mental state.